The next test that I've kind of come up with a bit here is called the wiggle test. This is a bit of a funny name, but it's a really good test for looking at tibial rotation in general. It's not necessarily isolating tibial IR or tibial ER, but it's just giving us a really quick sense of how well is the individual's tibia moving. Because oftentimes when someone comes in with maybe ACL injury from 5 to 10 years ago, had surgery or not, ankle sprain injury history, they're going to start losing a bit of that rotational control and rotational mobility through their tibia. So with the wiggle test, there's a few different components to it here. I first came up with the test in supine, but this prone version of the test is much nicer because it's going to actually stabilize the femur. So the femur is nice and stable here on the table. I'm going to take her left side first, her unaffected side, and I'm going to show you the technique here as we grasp the ankle. So same position as the prone dorsiflexion test. I'm just grasping right around the midfoot. I'm not necessarily choking up too high towards the talus. It's more just in that midfoot area. And now all I'm going to do in this position is I'm going to start in more of an ankle neutral position, aka a bit of plantar flexion. We're not going to crank full dorsiflexion first. So first, this more neutral position, and I'm just giving it a nice axial rotation. So we see on this left side with a neutral ankle position, that's her tibial mobility. I can then fully dorsiflex her, and I can do it again. And now that's going to be a little bit tighter because now we're taking some ankle play out of it. We're fully dorsiflexing her. And from here, now it's going to be more purely tibiofemoral joint. How well are we getting movement of the tibia on the stabilized femur on the table here?